Welcome everyone, and thank you so much for joining us today. My name is Marian McGill, and I am the Manager of Global Partnerships at SunLife. I'm pleased to be here today representing SunLife. At SunLife, we see firsthand the impact that diabetes has on our clients around the world. Since 2012, we've proudly donated more than $31 million towards diabetes, awareness, prevention, and treatment initiatives, and this includes the fabulous partnership that we have with the University Health Network. On this day, in fact, 3 years ago, to help celebrate World Diabetes Day, SunLife announced our commitment to launch the SunLife Diabetes College with the goal of helping to improve health and wellness around the globe through diabetes prevention and management initiatives. If you've not already done so, I would encourage you after today to visit the fabulous online resource. There's so much great information there. Today, though, I am pleased to introduce two experts who are here with me at the University Health Network. Dr. Paul O is Medical Director of Cardiovascular Prevention and Rehabilitation Program here at the University Health Network and Assistant Professor of Medicine at the University of Toronto. Nilu Delami is a registered dietitian at the UHN Cardiovascular Prevention and Rehabilitation Program as well. And the two of them will be coming up now and walking through some really great information on nutrition as a means to prevent diabetes. So please join me now in welcoming both to the stage. Thank you very much.
Terrific. Well, thank you very much, Marian, for the kind introduction. It's a thrill to be here with you today virtually. We are very, very grateful for the opportunity to share lunch with you wherever you are and share some information on this occasion of World Diabetes Day. Nilu and I will be delivering this presentation in a joint fashion. We'll be going through aspects of diabetes overall and approaches to appropriate management using nutrition as medicine for the better control of diabetes. And then I think of interest, particularly to the group for today, will be a discussion about popular diets, what's good and what might not be so good about those kinds of programs and patterns of eating. So why nutrition? Of course, everyone eats, and maybe you're eating right now. We make a choice every time we have a meal. Some things will be helpful to prevent diabetes. Some things will be helpful to control blood sugars. Some things may not be so friendly for our bodies and our metabolism, and we can take some steps to better understand that. As mentioned, we'll talk about a little bit about the stats about diabetes, why we are so grateful for this collaborative opportunity, and how there is a close relationship between diabetes and nutrition. If you have any questions at any time, we'll be monitoring this email over the course of the next hour. We would really, really appreciate you sending in some questions for us. And we'll have a generous question period towards the latter part of this hour so that we can actually address some issues that are topical for you. Some of these things will be important for the people that we see that might be in our families or in our lives. Some of these things might be quite personal for us, and hopefully we can address them. If we can't get through all of the questions, we'll be happy to follow up via email at the conclusion of this session. Let us also say that we're very, very grateful for the opportunities that this collaboration with SunLife has afforded us. To develop this online resource that's called the SunLife Diabetes College has been tremendous. We've had opportunities to collaborate with partners all across this country and indeed around the world. The opportunity to develop and curate information that's helpful for patients who are living with diabetes or trying to prevent it, or for their family members, has been a tremendous opportunity for us over this last decade. And in these last 3 or 4 years, developing and sharing these resources has been one of the highlights of our program. We are also aware that SunLife has been a tremendous partner for other important initiatives at UHN around diabetes, and your commitment comes through loud and clear, whether it's supporting the National Diabetes Action Canada program or through eHealth Solutions through our technology partners at UHN. Your presence is felt each and every day by thousands and thousands of patients that come through our doors. Okay. So why should we be talking about diabetes? Why are you so heavily vested in diabetes? This is a common issue, isn't it? We know that 1 out of 3 Canadians today are either living with the condition of diabetes type 2 or type 1, or are at risk of developing diabetes because they have slightly elevated fasting sugars or sugars after a meal, so-called pre-diabetes. And actually, I think most Canadians in the entire population actually are at risk for developing diabetes. It's more of a continuum as opposed to a specific threshold, yes diabetes, no diabetes. We're all on that continuum. It not only has an impact on numbers of Canadians affected, but we know diabetes is a head-to-toe disease and can affect important organ systems like our visions, our brain, our heart, our kidneys, the nerves in our hands and our feet, the circulation that goes to our toes. And it's not surprising then that diabetes carries with it a huge financial and clinical impact. And the slide shows us that many of the cardiovascular conditions that we deal with in our daily lives, such as stroke or heart attacks, can relate very closely to developing diabetes. And we know half the cases of kidney failure that ultimately lead to costly interventions like dialysis relate to diabetes. We certainly need solutions, therefore, so that we can better manage these conditions in the first place. If we think in very broad terms, very succinct terms about risk factors for developing diabetes, we would have these two kinds of categories. On the left-hand part of the slide are those non-modifiable risk factors, the things we really can't change, such as family history or ethnicity or age. We know that there is a strong genetic component to diabetes, and we need to choose our parents very wisely if we can. Certain ethnic groups are at higher risk, and in particular, South Asian populations we know are developing diabetes at earlier and earlier age. And thinking across in our global communities, this then presents a growing epidemic of diabetes cases around the world and its concomitant complications. As we get older, we're also seeing more type 2 diabetes develop in our populations. We're also struck, of course, of the younger people who are developing type 2 diabetes as a result of modifiable risk factors that are discussed on the right-hand side of this page. So we could call out many issues. The two that will be the focus of upcoming discussions include inactive lifestyles. Sitting too much, not moving enough with purpose also contribute to elevated blood sugars and developing diabetes. In fact, it can double your risk of diabetes. So at your desks, if you're in a desk right now or in a boardroom, take the time. Just stand up, move about, get your circulation going. That is also good for priming your metabolism. Finally, the last part of this preamble is that we know that poor eating habits may also contribute to developing diabetes. So I am very, very delighted that we're able to bring this topic to you. This very, very busy slide talks about the Diabetes Canada 2018 guidelines around nutrition. A few things that are remarkable. One, it is incredibly busy and the print is very, very small. You may not actually see any details in here, so let me highlight a few things. If the print is small, that usually means a lot of smart people spent many, many hours looking at a wealth of detail in clinical literature. In fact, 250 studies were examined very closely by nutritionists, dietitians, physicians, pharmacists, and from there they were able to distill out a few key ideas. That certain patterns of eating are beneficial in terms of lowering sugars on a daily basis that leads to better control over longer term. That is evidenced by this marker called hemoglobin A1C, which is essentially a 3-month average blood sugar that can be measured from a simple blood test. We can also see that certain patterns of eating are also helpful in terms of avoidance of stroke and heart attacks, so-called cardiovascular disease events. Other things that we can see from dietary patterns is that we can achieve improvements in cholesterol control or markers of inflammation, such as C-reactive protein. There are also potentially some challenges with certain patterns of eating, inconvenience, effects on the body, but those are often trumped by these good things that we can achieve with glucose control and better heart health. Going down the left-hand side of this that sets the stage for the ensuing discussion, we can see that there are certain patterns of eating that are better than others. Macronutrient-based approaches that look at whole food patterns of eating is one, probably the best approach that we can take. And as a subtext of that, certain specific patterns of eating that we see in different parts of the world. My colleague Nilu will go into these in detail. What is also seen on this slide are certain kind of fad diets that may be popular, that may induce some short-term benefits. The effects on heart disease we're less sure about, but they also enter into the evidence base for things like short-term weight reductions or short-term improvements in cholesterol patterns. We'll talk about the pros and cons of that in the coming few minutes. Let me turn this over to Nilu now to take you through some of the common patterns of eating.
So I'm very thrilled to be here on World Diabetes Day because with diabetes, it's one of those conditions that can really be prevented and managed through nutrition. So as Dr. O showed us, there's a lot of evidence to show that healthy eating patterns can help with blood sugar management, with lowering cholesterol, lowering risk of cardiovascular diseases as well. So I'm going to take that very complicated slide and break it down into some of the patterns that we have. You'll notice that some of them are quite similar, and I'll point out some of the differences as well. So the first one we have here is the Mediterranean diet, which is quite popular. There's a lot of evidence that it can reduce our risk for cardiovascular disease. It does actually help with diabetes management as well, and the prevention of diabetes. So this is a dietary pattern that was actually discovered in Greece post-World War II, where they found that the rates of heart disease were very low compared to 7 other countries that were compared with Greece. Now, what it is a traditional eating pattern that is followed around Greece, Spain, and Italy, so the countries around the Mediterranean Sea. And it's primarily a plant-based diet. So if you see at the base of the pyramid, we have a lot of fruits and vegetables, whole grains, nuts and seeds, legumes, so your beans, chickpea, lentils. The main source of fat that's recommended as part of the diet, as you know, olive oil is widely used in Mediterranean cuisine. As you go up, you see that there's a recommendation for fish, especially fatty fish like your salmon, mackerel, sardines, and seafood around 3 times per week. If you keep going up the pyramid, you see that you have less of those higher fat dairy, higher fat poultry, and eggs. And then at the very, very top is where you see the red meat and the sweets. It's not to say that you can't enjoy them as a part of a healthy eating pattern, but limiting the red meat, the processed meats, has been shown to improve cardiovascular outcomes. Now,
I wonder if one thing we might interject, we're going to make this conversational.
Yes.
I hope that's okay.
Yes.
One of the things that we could suggest to you, viewing at home, if you want to know how Mediterranean you are, one of the excellent tools at the Diabetes College website is actually a Mediterranean diet score figure. So you can go online, go to the site www.diabetescollege.ca, pull up into the nutrition section, find the online tool, and you can score on 13 items. Is that right, Nina?
Exactly. It's 13 yes or no questions. So every yes that you get is actually a point. Now, anything above 9 means you're doing quite well. Anything below 9, so an 8 and below, means that you are at, maybe at higher risk. And every point that you add actually reduces your risk of heart disease.
So I'm grateful to Nilu and colleagues for actually developing this version of the tool, posting it online. I know I go to it often just to see how Mediterranean I am. How do I look? So there's always steps that we can take to make ourselves a little bit more Greek, a little bit more Italian, and a little bit healthier in terms of our dietary patterns.
And what's really exciting about the Mediterranean diet is that you don't actually have to eat like a Greek or an Italian to enjoy the benefits, right? So every culture has vegetables, most cultures have beans, some sort of fish. So it is possible to adapt this sort of pattern to many different cultures. So we'll move on to the DASH diet. So DASH actually stands for Dietary Approaches to Stopping Hypertension. Dr. O, this is usually recommended to patients who are struggling with blood pressure. There is evidence that it can bring it down. Again, you'll see that it's quite similar to the Mediterranean diet in that it's very plant-based and there are less of those higher fat animal products. What makes this a bit different from the Mediterranean diet is that it's a bit more prescriptive. So you'll see there are specific serving sizes recommended per day for vegetables and grains and everything that's on that pyramid. And there's an emphasis on sodium as well. So it is recommended that sodium be limited to 1,500 milligrams a day as part of the DASH diet. If you think in terms of teaspoons, that would be 3/4 of a teaspoon of salt.
This pattern is interesting to me. Thinking about blood pressure control. Now, of course, blood pressure in people living with diabetes is incredibly important. In fact, we have a blood pressure target that's 10 points lower if you live with diabetes than if you don't. Because we know that the combination of diabetes and high blood pressure can be very challenging on key organ systems like the kidneys. The other neat thing about this diet, as Nilu said, that you can lower blood pressure by as much as 11/6 millimeters of mercury in a period as short as 8 weeks of dietary intervention. So having that extra fiber and plants and veggies, and nuts and seeds, I say this is as powerful as any drug that I can give you. And it gives you all of those other benefits as well. So think DASH also.
Yeah, think DASH, think Mediterranean. And the thing with these patterns is that it's not just about what you can limit or what you should limit. It's about what you can add. So adding those fiber-rich foods, adding those healthy oils can help with preventing things like blood pressure, cholesterol, and diabetes. Vegetarian and vegan diets as well. You may notice that there's a theme here, lots of plants in all of these patterns. So vegan diets, as you may know, they include no animal products. With vegetarian diets, it may vary. So we have lacto-ovo vegetarians who have dairy and eggs, or you might have people who will just have dairy and no eggs. But in general, they've also been found to have benefits in diabetes prevention, management, and also all those heart health benefits as well. Then we have the portfolio diet. So the portfolio diet was actually developed for managing cholesterol, but we found that it actually helps with diabetes prevention as well. So it's a portfolio of foods that help lower cholesterol. Similar to the DASH diet, again, it's a little more prescriptive. The recommendations are to follow a plant-based diet with specific emphasis on nuts, around 45 grams of nuts per day, viscous fiber, which is a soluble fiber that dissolves in water, and it's what you find in things like oats and okra and beans, chickpeas, lentils, so 20 grams of that per day. Plant protein, so getting most of your protein through plants, so things like soy protein, beans, chickpeas, lentils, nuts and seeds, all excellent sources of that plant protein. And then we have plant sterols. So plant sterols we find in very small amounts and naturally occurring in foods. However, we do have things like margarine and yogurt that are fortified with plant sterols. Now, by having around 2 grams of plant sterols per day can reduce LDL, or that bad cholesterol, by up to 10%. So this is what the portfolio diet recommends, and again, it has those benefits for both blood sugar management as well as cholesterol and blood pressure and that whole cluster of conditions.
Great. Fun fact about Portfolio, if anybody's following along, that Portfolio is a Toronto invention that our colleagues at St. Michael's Hospital, Dr. David Jenkins in particular, has had a long history of nutritional interventions around diabetes and cholesterol. So this is another unique Toronto thing, along with the discovery of insulin, for instance. So we're glad to be at the hotbed of kind of interventions to help prevent and manage diabetes better.
Now, we've talked a lot about diabetes and heart disease, but these sorts of patterns that include a lot of those unprocessed whole plant foods actually have benefits for mood and cognition as well. So maybe you could walk us through this beautiful slide.
Thanks, Neela. So this slide is drawn from a source from the UK that talks about brain health. Now, what's the connection between brain health and diabetes? Well, everything is connected, isn't it? Then having too much sugar in the blood, having too much cholesterol in the blood, not having good circulation to the heart and the brain into the kidneys all connects together. And we find that there actually is a great deal of overlap between people living with diabetes and having low mood or having fogginess with thinking. So food patterns have also been looked at for brain health. And you'll see that there's actually a lot of similarities. So here's another pop quiz for you as you're sitting at your desk or in your boardroom. On the left-hand panel is statements that describe your mood, and then 2 thoughts about foods to avoid or foods to consume to help your feeling right now. So if the upper left box, if we focus there on the green, for instance, if you are saying, I am increasingly confused, forgetful, and disorganized, one thought is that that's characteristic of a pattern where we might not have enough of the neurotransmitter called acetylcholine in our brain. This is what characterizes people as they're developing cognitive impairment later in life, or severe lack of acetylcholine is what characterizes full-blown Alzheimer's dementia. So in the early stages where we might be feeling a little bit forgetful, then we could think about how that relates to food patterns. So if this describes your lunch, I'm eating sugar that's deep fried in nature, that might be refined and processed, and I'm having a beer chaser or a glass of wine with that. That might be a fun kind of lunch, but it may not be the friendliest for your brain. Instead, if you're choosing more of the attributes that Neela has described with Mediterranean types of patterns where we're having free-range eggs and wild fatty fish or tuna and sardines, then this might actually enhance our memory skills and allow the executive function to come out. In the middle might be a pattern where you have a low mood, you have trouble with sleeping, either falling asleep or waking up too early, you're lacking joy in your life or you're feeling detached. If this is your state during this lunch hour, the food to avoid specifically, there's only one, and that's alcohol. A lack of serotonin is thought to be this neurotransmitter, and we know that serotonin actually relates to depressed mood. And we use medication sometimes to boost the serotonin in our brains to help us feel better. Instead of these kinds of medications, we could again reach for foods that will make us happy. Fish, fruit, eggs, avocado. Gosh, there's a shortage, isn't there? I see people panicking right now, but there is still avocado out there, and low-fat cheeses and lean poultry. That can be mood elevating in nature. Third pattern that we can talk about with moods, if you find it that it's hard to relax, you're anxious, you're irritable, and or self-critical, we all have days that might be looking like this. The neurotransmitter in question might be GABA. And if you don't have enough GABA, then you're getting this kind of excitation in your system. Things that will make you more excited, like sugar, alcohol, caffeine. You've had this feeling where you're getting jittery even more when you're introducing these into your diet. We can calm you down. Instead of using drugs like benzodiazepines that affect the GABA system, we could instead have a hit of some dark green veg, maybe a banana and a handful of nuts. How about a sweet potato to calm you down with an egg chaser? Interestingly, it's very interesting, isn't it, how powerful food can be. And sometimes in medicine we've relied on medications to do this. Sometimes instead we can rely on food to do this. And in the middle column of things to avoid, if you've been keeping score, you'll see that there's one common element to all three. That is alcohol. Maybe alcohol isn't the friendliest thing to have for lunch. The second thing would be sugar and things that are processed. So if we eat lean and green and think healthy, this is good not only for our diabetes and our hearts, but also for our brains. Back to the story.
Back to the story. So lean and green. So if you look at all the diets that we just presented, they are lean and green. So what do they all have in common? Is that they're whole foods that come from plants. And that's the theme that you see across all the diets. And it's also what's been captured in our new Canada's Food Guide. So I don't know if everybody's had a chance to actually see this food guide. It came out early in the year. And what it really promotes is that plant-based eating as well, eating plant-based foods that are whole and unprocessed. So it's quite simple. It's not like the old food guide with all the numbers and the servings. It's just a simple plate. And what the recommendation is to follow a plate that has that is half fruits and vegetables, a quarter of whole grains. So whole grains could be your whole grain bread, brown rice, quinoa, whole grain pasta, lots of variety there. And then a quarter of a plate would be where your protein comes. Now with the protein, you have options to have leaner animal proteins or healthy proteins like fish that give you a lot of good fat. And then you also have the option of adding more of those plant-based proteins. So your nuts and seeds, your beans, chickpeas, lentils, split peas, your tofu, edamame, so lots of variety there as well. Now the food guide not only talks about what we should be eating, but also comments on how we should be eating. So in a society that is so fast-paced, oftentimes we might not make enough time to prepare meals, enjoy meals, cook at home. So the food guide really does emphasize the importance of being mindful with your eating habits, cooking at home as often as you can. Enjoying your food, so enjoying your foods with your friends and your family, and really bringing back those positive eating behaviors and attitudes.
Yeah. Isn't this kind of capturing one of the elements of Mediterranean, isn't it, right?
It really is.
Mediterranean is more than just food.
Mm-hmm.
It's about being social, and if you have alcohol in that context, that's cool.
So older versions of the Mediterranean diet actually would put a glass of wine instead of water. So that's sort of changed now. Now we have water as the beverage of choice, but you know, alcohol in moderation can be, you know, enjoyable as well. And it's not, you know, coming back to mindful eating, it's not about being too strict, over restrictive. It's about what you do most of the time. So eating the best you can most of the time, and then also giving yourself a little bit of flexibility to maybe eat foods that are at the very top of that pyramid.
So all of this creates a foundation on how we can really manage our health in the best way. For people living with diabetes, one other thing that people can do is actually check on their own progress. So the notion of self-monitoring of blood sugar may be one other important aspect of self-care. In a couple of weeks, in our second session in this series, we'll be speaking a lot more about self-management overall. But how do you know if your food pattern is actually making a difference? Well, we can speak with our clients directly and say, just check your sugars. And it's remarkable the differences that one can achieve by swapping out sugar, deep fried, processed, to lean, green, healthy fat. And you can see early morning sugars drop down by a couple of points. The load after having a lunch that's healthy versus unhealthy, we can see those sugar levels kind of tail off in a nice healthy way an hour or two after dining. So these are going to be really important aspects. The cartoon also shows us that there's evolution of how we've done monitoring over time. The left-hand part of this slide talks about the old ways where we waited for sugars to go way up and we can actually detect it in the urine. We don't do that so much anymore. We can do glucose checks right from the finger on a periodic basis, or some people now are moving towards these sort of flash devices where a little sensor can be just inserted underneath the skin, and you can do very regular checks throughout the day with these kinds of devices. So nice evolution, helping us self-monitor and assessing the effects of lifestyle interventions like nutrition or physical activity.
And with the self-monitoring, we have these general recommendations for diabetes management and nutrition, and that's a starting point. But it's also important to keep in mind that diabetes is an individual condition as well. So two people who are living with diabetes might have a different tolerance to carbohydrates, different types and different amounts. So there's a lot of detective work and self-learning that has to happen for the person to learn exactly what amount and what type of carbohydrate works for their metabolism. So that's when the self-monitoring is very important, especially early on, right after diagnosis. It can be very valuable.
Terrific. Yeah. So moving on to the third part of this program, we'll talk about some current diet trends. And we've seen this in popular press. We've seen it on websites. We've seen it on Twitter. Are you up with the latest thing? And I'm not. But fortunately, I work with people who are. And it's interesting that our patients may be bringing this forward. The professionals whom we work with might be bringing this forward. And certainly in the medical community, there's lots of discussion about this. And there are proponents, but there are also those that may not be so much in favor of these so-called fad types of programs. We're going to delve into a couple of these patterns that have been really quite popular, more so in recent times, around diabetes prevention and management. One pattern might be called intermittent fasting. The other would be ketogenic or keto. So Neela's going to take us in a little bit of detail of what these patterns of diet really represent and the pros and cons.
Sure. So the ketogenic diet is actually not a new diet. It's been around since the 1920s. It was actually used in children who were living with epilepsy. And they found that these children, when they went on this ketogenic diet, they had less seizures. And it was actually comparable to medications. Now, since then, a lot of medications have come that are more effective at preventing seizures, but really that's where the ketogenic diet originated. So what the ketogenic diet is that typically when we eat foods that have carbohydrates in them, so that could be your grains, your legumes, your beans, chickpeas, lentils, fruit, starchy vegetables, and some dairy products, they have carbohydrates. We digest them, and that turns into sugar or glucose in the body. And that's what we use for fuel. That's what our brain uses for fuel, our muscles, our cells. Now, if you go on a very low carbohydrate diet, and a very low carbohydrate diet would be less than 50 grams or even less than 20 grams in some cases. Just to give you some context, actually, so it's like a medium banana will give you 20 grams of carbohydrate. So you can imagine how little carbohydrate you would have to have on the ketogenic diet. So what happens after around 4 days is that your body actually runs out of all those sugar stores or glucose stores, and you actually turn to fat for energy instead. So you start breaking down fat into what's called ketone bodies, and that's what your brain uses. So that was working well with children living with epilepsy. Because of its focus on the carbohydrates, there's actually interest in the ketogenic diet in managing diabetes, because at the end of the day, diabetes is an intolerance to carbohydrates. So what the ketogenic diet looks like is we have some foods that are allowed or included. So this is all foods that virtually have no carbohydrates. So we have our non-starchy vegetables, meats and deli meats, poultry, eggs. You see a lot of animal foods in there. We have fish, nuts and seeds, and we have some fats, so avocado and oils that may come from plants, but also animal fats like cream, butter, and cheese. Now, foods that are excluded are all fruits, starchy vegetables, so think of things like potatoes and sweet potatoes may be excluded. Some dairy products like milk, for example, a glass of milk might give you around 15 grams of carbohydrates. So if you're limiting your carb to 20 grams, milk wouldn't really fit into the diet. Grain, so any sort of grain, of course, has carbs or starch, so that's eliminated as well. Your legumes, so your beans, chickpeas, lentils, think of them as half protein, half starch. So those would also be eliminated. And then, of course, any added sugar, honey, sugar-sweetened beverages as well. Now, after 3 or 4 days, your body sort of transitions into the state of ketosis. And you can't really come in and out of ketosis. You have to be very strict about limiting your diet to less than 50 grams, because if you go, let's say, to 55, 60 grams, then you're not in the state of ketosis anymore. You're just on a low-carb, very high-fat diet. So people who do follow it have to be very strict about it. So with any diet, with any dietary pattern, there are a few questions to ask. So first, is it safe? Right? So with the ketogenic diet, some risks, because you're cutting out a lot of foods, might be nutrient deficiencies. So some people might need to go on vitamins or multivitamins, or meet with a dietitian or an expert to help them meet all their requirements. Constipation can be a bit of an issue because fiber, again, is a type of carbohydrate. We're cutting out all those carb-rich foods, so a lot of fiber is cut out as well. Usually people get over that in a couple of weeks after starting the diet. And then there's the keto flu symptoms. I don't know if you've heard of the keto flu. So it's, some people might feel nauseous and dizzy, might have some brain fog. Again, these tend to subside after. It's really that transition phase where your body's changing from using glucose to ketone bodies. So those are some of the short-term risks. And then long-term, because it's such a meat-heavy diet, there's that risk of kidney stones. And this is something that's still being studied, but our gut bacteria actually feed on fiber. So our healthy gut bacteria needs fiber to grow, and we're cutting all of that out. So there are questions as to whether it's changing our gut bacteria in a negative way, not allowing those healthy bacteria to grow. Now with people on medications, there are risks as well. So if people, especially with diabetes medications that lower blood sugar, there's that risk of hypoglycemia or low blood sugar if you're still taking the medications but not having any carbs at all. So really, if you are considering on following this sort of pattern, it's important to talk to your healthcare providers, your physicians, dietitians, so they can sort of guide you through it in a safe way.
Good advice, yeah.
And then we want to think about what's the evidence. It is quite a restrictive diet, so is it even worth going on it? Will it improve health outcomes? So what the evidence shows is that in the short term, there are reductions in weight and blood sugar as well. Now, we need to keep in mind that most of these studies last up to 12 months, maybe up to 24 months, but we don't go beyond that. So we don't really know if these benefits will stay long term. The findings on cholesterol vary because, as you notice, there's a lot of meat, butter, bacon. So in some studies, they show actual reductions in cholesterol. Some show that the cholesterol goes up and then will start to come down, and some show that it does actually go up, the cholesterol. So it is possible that the type of fat that's included in the keto diet can have an impact on that. And again, the long-term effects, even with heart disease, diabetes, we don't know because it's a relatively new area of research. And then we also have to think about, is it sustainable? So it can be restrictive. We're cutting out a whole list of foods, some of which are quite enjoyable. And then, you can't go over 50 grams. So if you go to 55, 60, you're out of that state of ketosis. So you constantly have to be monitoring it. It can be a little exhausting. So adherence can be a little challenging, especially in social situations, because it's not really aligned with the eating patterns that our society really follows. And then we also have to think about the environmental impact. So we are recommending, or the diet is recommending, a lot of animal products. So with everything that's happening with climate change, is it really responsible to be recommending so much more intake of red meat and animal products in general?
That's a great overview, and I think you've shed some important lights on what might be good or bad. You can see why people might be reaching for this kind of pattern. Lower the sugar. If your focus is just on weight, then this might be an effective way. But what do you think about that? Should the focus just be on weight? And if I eat more steak, I'll just get a lower weight?
So at our centers, at our program, we actually don't focus on weight, that number on the scale as much, because we find that doesn't tell you enough about what's going on internally. So it doesn't tell you about your cholesterol levels. It doesn't tell you about how much muscle you have versus versus fat. So just focusing on the weight loss may not be ideal, and also in terms of yo-yo dieting, right? So if you go on the keto diet, you lose a lot of weight, and you are not able for whatever reason to sustain it, then your weight will go back up. And it's similar with a lot of these diets that promise rapid weight loss. So the question is yo-yo dieting more harmful than just having a stable weight?
Right.
Yeah.
And it probably isn't, is it?
Probably
in terms
isn't.
Of long-term heart
in
risk,
terms of long-term heart risk, it's much nicer to have a stable weight. So you eat well, you exercise, you take care of yourself, and wherever your weight falls naturally, that's where your body sort of needs to be at. It's where it's comfortable at.
That's great. And I think to our knowledge, there's been no large randomized study that says eating a lot of bacon and sausage is the best way to health. Are there other ways of approaching a keto type of program that wouldn't be so heavy saturated fat, I guess?
Yeah, so as you saw on the list, there were things like avocado, olive oil, nuts and seeds, nut butter. So these are all good fats. So and fish as well. So fish gives you that good fat as well. So I have patients who go on the keto diet, and there are always two types. So there are ones that go on the keto diet but follow a healthier keto pattern, if you could think about it that way, with more of those plant-based fats or those fattier fish. And then there's some people who choose to go with the bacon and the red meat. And that's something that we don't really recommend, again, because we don't know the long-term effects, and also when we think about cancer risk, right? So eating too much heart disease, of course, there's been links between too much processed meat, red meat, and heart disease, but also some cancers. So it's something to keep in mind.
That's great. Yeah. So it's interesting for us working with people, trying to reconcile maybe our worldviews. And we're always willing to meet people in the middle. If they're coming to us saying, I want to really be low carb, so-called keto, we can explore that further, right?
We explore that. We support the patient. Ultimately, it's up to the person, right? And as healthcare providers, we're there to support whatever decision they make and make sure that it's an informed decision as well.
Perfect. Okay, kind of fad diet number 2.
So then we have intermittent fasting diets. And where these diets come from, the theory behind it is that humans evolved in an environment where we had fasts and feasts. So times where we had food, and then times where we would not have access to food. So we would be fasting for long periods of time. So the theory is that our dietary patterns today, with the 3 regular meals and the snacks, doesn't really match our metabolism. So there are a few approaches to the intermittent fasting diets. There are 3 that are quite popular. So we have the 16-8. So that's a 16-hour fast. Of course, during all of these fasts, water is allowed because you don't want any dehydration. Normal eating for 8 hours. So during the 8 hours where people are eating normally, there's no restrictions on what you can eat. So it's just the only restriction is that you're allowed to eat for those 8 hours. The way people typically do this is that they stop eating at 8 p.m. and then their next meal would be at noon. So it's an overnight fast and then skipping breakfast, essentially. And then we have the 5-2 diet. So the 5-2 diet is where you have normal eating for 5 days a week, again, no restrictions. And then for 2 days of the week, it's very, very low calorie, 500 to 600 calories, a lot of broth and liquids there as well. Then we have the alternate day fasting. Alternate day fasting is exactly what it sounds like. So it's fasting every other day. Some people do 24-hour fasts. I've heard people go up to 36-hour fasts as well. And on the non-fasting days, again, there are no restrictions.
So we're getting responses in this room from our foodie friends. The notions of fasting for extended periods of time are not being met with great enthusiasm, unfortunately. But it is interesting, and where we could go with trying to change timing of eating. And
exactly.
So why might this be kind of thoughtful?
So again, we want to ask the same questions. Is it safe? So again, we have those short-term risks, constipation, headaches, fatigue, poor concentration, but after a while of following the diets, people's bodies usually adjust. And again, because people are not eating for long periods of time, if diabetes medications are there, then that's a conversation to have with your healthcare providers, because there is that risk of low blood sugar as well. So what the evidence is that there have been studies, again, short-term studies, just like with the ketogenic diet, that show potential reductions in weight and blood sugar. But they actually find that the improvements are not very different than just eating a bit less and eating healthier every day. And again, the long-term effects are yet to be studied, because again, it is a newer area of research. In terms of sustainability, it really depends on the person. So there are some people, and studies have found this, and I've found this clinically as well, that some people actually really love that they can not eat for those 16 hours and then not worry about what they eat for those 8 hours. And that's something that they can sustain and adhere to. Some people, life gets in the way, it's a bit difficult to actually sustain. So it really depends on the person.
Thinking of the one pattern, it really goes against the notion that breakfast is your most important meal, right? Because it's going to be the one you cut out.
Exactly, exactly. And again, for some people, they just can't do it. They say, when I don't have breakfast in the morning, I cannot function. Other people are just not breakfast eaters. They never have been, so it works for them.
So do you think this is an overall calorie reduction because we have these periods where we don't eat anything, or is there something else about resetting our metabolism in the fasting times?
It might be something about resetting that metabolism, especially with the timings.
Okay.
Yeah.
I worry about unrestricted eating for 8 hours at a time. I could do some damage in that period of time. But I guess for all of these things, we should still be thoughtful about quality and quantity in the periods of feast or famine. That's feast, right?
Yes.
Yeah. Okay.
Yes.
All right. So we've come to the end of the formal parts of our presentation. We're grateful for the time that we've had, but now we're into question period. So we wonder if there's anything that has come up over the course of these last number of minutes. Anything that you want to ask, please do send it along to the email address that we provided at the beginning, which is shown somewhere. trf@uhn.ca. trf@uhn.ca. The first question that's come in is, we've talked about how the food patterns might be helpful around managing blood sugar better. What about the notion, can we actually turn diabetes back? Can we actually reverse diabetes by the foods that we choose?
So with healthy eating, with managing the amount of carbohydrates you have, doing all that self-monitoring, making sure you're active, your numbers can go down. So your A1C values, your blood sugar values can go down. They might even go down to below the diabetes range. But the issue is that if you go back to eating a lot of carbohydrates, that doesn't work for your body, you will find that it will start creeping back up. Now maybe we can comment maybe on bariatric surgery.
Please.
Yeah, so one of the ways that diabetes can actually be reversed is by surgery. So bariatric surgery, maybe we could talk about, if you're removing parts of your digestive system where the carbohydrate metabolism and absorption happens, or bypassing that, then your blood sugar will not rise after eating. So that can reverse diabetes, but just healthy eating, you still are living with diabetes, but you're managing it well.
That's great. And back to this notion where diabetes really is a continuum. It's not a single step, a single threshold, that potentially all of us have the ability to develop diabetes given the right circumstances. May not be the healthiest circumstances, but it's there. So we can come back on that spectrum as well by the choices that we make around our health.
Absolutely, and it's a lifelong condition, right? So there are periods where management might be great, and then there are other periods where some adjustments have to be made, and that's just the nature of the condition.
Great, thank you. Second question coming up. So in the different patterns of eating, is it possible to have too much of a good thing? Can you overdose on seafood, for instance, if you have it every single day? Is there such a thing as too many blueberries or too many avocados?
So really, you can have too many fruits, too many vegetables, right? What would that do? It would probably give you diarrhea, right? So it is possible to have too much of a good thing. We want to think about healthy patterns, balance, variety as well. Remember, every food has unique properties, so having a variety of healthy foods can help you take advantage of all the benefits of those different foods. With fish specifically, some fish may be higher in mercury, like larger fish like tuna, so maybe not eating it every day, but limiting it to that 3 times a week. You're getting all the omega-3 you need by having it 3 times a week. You don't really need to go beyond that. And then back to sustainability as well. With fish, we have to think of the environment as well. So is it good for the environment to be having too much fish?
That's great. So variety is important.
Mm-hmm.
So let's, this next question is comments on the vegan diet, please. If you're interested in switching over, what should we keep in mind? And whenever I'm asked this question, working alongside dietitians is incredibly important. I say going to a strict vegan program is not for amateurs, I would say. So please talk to a professional. And what advice do you provide?
Please talk to a professional, or go on reliable websites and actually look at what you would need to be having on a vegan diet, because you are removing some foods, right? You're removing all animal foods, and animal foods, for example, like dairy would give you calcium, other animal foods would give you B12, so going on that, and protein as well, right? So with animal proteins, they're complete proteins. They have all the amino acids that we need. With the plant proteins, it's a bit different. So they don't actually have complete plant protein. So with B12, a few things you can do. You can add nutritional yeast. So 2 tablespoons of nutritional yeast could be added to things like salads and smoothies and cereals. So that could give you the right amount of B12. You could also, some people also actually take supplements because it's just easier. Iron as well is an issue. You can get iron from plant sources, so things like beans, chickpeas, lentils, all give you a good amount of iron. The key is to have it with something that has vitamin C to enhance the absorption, and to avoid any tea or coffee for a couple hours after. And then with protein, you can get all the amino acids that you need, but the idea is to get your protein from a variety of different sources of protein, including your legumes, even whole grains have some of those amino acids as well. So again, it comes back to variety. And lastly, calcium, you can get that from tofu, you can get that from fortified soy and almond beverages, so a lot of alternatives. It's just that you need to be educated on what might be missing and how you can add them back into the diet.
That's great. The next question is about, would you recommend the zone diet that was propagated by Dr. Sears? And if yes, the ratio that's specified is 40% in carbs and 30% protein, 30% in fat.
Mm-hmm. So again, it really depends on where those carbs are coming from, where the fat is coming from, where the protein is coming from. I haven't read any specific studies on the zone diet, but I could look into that and get back to you with more specific evidence on the zone diet.
Based on the carb component there, that's not a low carb kind of diet.
No.
It's up in the medium sort
it's
of
up
range.
in the medium, yeah. So carbs, typically it's 45 to 65% of the traditional Western diets comes from carbs. So that's not a high carb diet, it's a moderate carb diet. Yeah.
All right. I'm sure we could fit in kind of healthy evidence-based patterns of eating into that as well. Okay. The next question is around, could staying at a consistent weight indicate that you're on a healthy diet? And I guess the corollary of that, if your weight's going up and down, what is that kind of indicating?
So I think we alluded to this earlier on the presentation. So with yo-yo diets where your weight is constantly going up and down, it's not great in terms of cardiovascular risk or heart disease. It's also sometimes an indication of not having very positive attitudes with food. So going on these diets, losing the weight, and then it's sort of this cycle, right? So really staying in that consistent weight that works for your body, there is evidence that that could be good for your health. Again, it's not just the weight, it's about what's going on internally. Yeah.
Something that we see in our program, or a pattern that we see in our program, for some participants coming to us after a heart condition, that they may actually lose weight in the program, and that might be quite deliberate and purposeful and desirable for them. It's not a goal that we'll actually set out for them, but it's something that they internalize. We probably spend more time focusing on waste as opposed to weight, isn't it?
Yes, precisely. So muscle actually weighs more than fat, but takes up less space. So when you're losing fat and gaining muscle, that number on the scale may not change, but the waist circumference might. And the waist circumference has been linked to cardiovascular risk as well. So that's why we don't focus too much on the weight alone. And we also focus a lot on the quality of the diet.
Great. Here's the next long question. When eating healthy and reducing or removing the intake of processed carbs from your diet, is it better to introduce some processed carbs once a week so your body still knows how to digest it, or just get rid of them altogether? Is it okay to have a bag of chips every now and again? I'm personalizing this question.
Well, I'll be honest, I have a bag of chips every once in a while.
Isn't that nice?
So with any processed food, again, we want to limit it, but we still want to enjoy things, right? So what we talk a lot about is the 80-20 rule. So 80% of the time you're having those unprocessed and whole foods. 20% of the time is where you give yourself a little wiggle room to have things like the potato chips or some cake. Your body won't forget how to process. It actually will remember quite quickly. But again, you don't have to be super restrictive either. Coming back to those healthy, positive eating attitudes.
I love that question, though.
Yeah, that's
I need the potato chips, or else my body will forget what to do with them. I think that's brilliant. Oh, here's another kind of interesting dietary program that I've never actually heard of before, but I'm glad I've worked with some really knowledgeable colleagues, about the Pegan diet, the P-E-G-A-N diet. New trend. Would you recommend this one?
So this one is an interesting one because it's a combination of the paleo diet, which is the dietary pattern that our Paleolithic ancestors or hunter-gatherers were following. So a lot of meat, nuts and seeds, berries. So think about what hunter-gatherers would eat. And then the vegan diet is all plant-based. So combining those two doesn't really leave much to eat. Because most grains are cut out, dairy's cut out, anything that has gluten is cut out. Of course, sugar and refined foods are cut out. But you're losing a lot of healthy foods as well. Very restrictive, might be difficult to follow long term. And again, I'm not aware of any studies that have been done to prove that it's actually beneficial.
That's great. Well, thank you so much.
Thank you.
We appreciate everyone joining in online. We appreciate you sharing your questions and insights. We've enjoyed this session very, very much, and we're sorry to draw it to a close, but we all need to end our lunch on a high note. If you enjoyed this session, please send a comment to trf@uhn.ca. If you didn't enjoy it, then you can talk to Maren about that. We can do better next time. But honestly, we're delighted again that this is a strong collaboration between our hospital program and a great partner in SunLife. We're very happy that we could bring this educational opportunity to you, and we'll look forward to our next session, which will be happening on Tuesday, November the 26th at 2:30 p.m. Special time, take note, 2:30 p.m. It's going to be all about self-management, the importance of nutrition and beyond, so that we can actually achieve better outcomes in diabetes. Thank you very much for your time and attention. We're going to sign off now.
Thank you.